Hi, good morning, everyone. Hope you're all doing okay out there. We're getting into opening up the state, and also we're getting into some semblance of normalcy. As some of you might already know, we were open, at least part-time, there for you for emergency care and other necessary dental needs. But I want to make a quick note and just go over some things with you. One of the issues I think we have these days is too much information out there. Just about everybody is hypothesizing and saying what we need to do and how we need to do it, which is great. But I think it's important to remember that this is a new situation. Unless you were around during the Spanish flu, we're kind of throwing a lot of stuff at this and figuring out what works and what doesn't. So I tend to like to communicate in simpler terms, and I'm hoping that what I convey here helps you kind of understand how to, go about life, at least in our dental office. But hopefully it'll help you for other things too. So let me just get to the CDC website here. Just some general information. You'll see it highlighted here, and you're welcome to go check this out on the website yourself. So to date, in the United States, clusters of healthcare workers positive for COVID-19 have been identified in hospital settings and long-term care facilities, but no clusters have yet been reported in dental settings or personnel. And why is this important? I'm not saying this to give you a false sense of security about dental offices. I'm saying that to let you know that there's some aspects of how we handle, dental care and medical care in a practice setting versus a hospital setting versus a nursing home. That makes it very different on the risk that you have of getting coronavirus. So how does that work? Let's go over this quick. You may have heard this. Hopefully you've heard this. Social distancing, isolation, most important. Barriers, handling air, what you breathe in. If you're around someone who's coughing, that's kind of middle importance. And lastly, it's hand washing and masks and things like that. What we're talking about here is what we do in the medical and dental setting, okay? So private practice, a lot easier to do this than in an acute center for COVID treatment like a hospital. Certainly nursing homes or long-term care facilities where people intermingle or have difficulty complying with not intermingling, much harder for this to happen. So, I think it's important at this time to remember space is still important. If you're into a medical setting, you probably see in dental offices things covered in plastic. Okay, that's because the plastic gets thrown away, the surface gets disinfected before anyone else comes in. And then what we talk a lot about is washing hands, which is always important, and then face masks, gloves, and eye protection. This has most to do with healthcare workers. But if you look at the spectrum here of what's most effective, what's not, I think we need to emphasize that space a little bit more. How does this apply to our dental office? I'm going to get to that in a second. Let's move on to what the CDC also acknowledges. It's impossible right now to know exactly how to handle this. We're still learning about the disease, and it's important that we all acknowledge this, right? There's a fine line of personal freedom and then caring for ourselves and others. And for each individual, that's up to you how you decide to do this, but let's make sure we have the information right. So I'm going to use this as an example as how we should approach this as a common sense thing. Okay, so let's take a look at this. And I'll tell you, there's a lot of online fighting going on about how this is not accurate and these numbers are not accurate. Well, I say throw that out the door. Just use your common sense, okay? So let's say this lady on the left here is a COVID carrier and this person is not, and he's wearing a mask. So let's say she coughs and it goes everywhere, right? This gentleman has his mask on, but it's not an airtight mask. He wouldn't be doing too well if it was an airtight mask. So there's a risk that things could get in on the side. And if he's in close proximity to an infected person, there's a decent risk he's going to get infected even with the mask. Okay, so now we go on to the second picture here. That person who has the disease has a mask on. She coughs, but the mask catches most of that aerosol and droplets. But there's still a risk that some of it could go out. Okay, and this person who doesn't have a mask now, that small amount they get out, he's at a higher risk. So now we look at this last picture where both of these people are wearing masks. The person who's a carrier coughs, it gets caught mostly in the mask. Some goes out, but then this lady on the other side has a mask on. So what she's breathing in is less likely to be what came out of the carrier's cough. So look, listen, we can have an argument, but it wouldn't be productive about, well, that works, it doesn't work. Just use your common sense. if you have something here that you don't want, and you have something here that you don't want to communicate, how many barriers would you put in? More, the merrier, right? So use your common sense. The reason I mention this, if you come into our office, you have to have a cloth covering or some sort of a mask on. Otherwise, we probably won't let you into the building. That's part of our protocol, right? Of making sure that we're doing everything we can to make sure that the area is as clean as it can be, okay? So, I was just looking through about how many fights there are. And we're spending so much time fighting about whether we need to wear a mask or not. You don't need to wear a mask. What I'm saying is you should wear a mask, okay? But that's a discussion for another time. If you come to our office, you have to wear a mask to come in, okay? So there's some key considerations that the CDC has outlined. You'll notice that we've been doing this since early March when I made the first video. We've obviously modified it. I'm not going to go through all of this because you folks can read. It's on our website, it's here. But it's simply using all the things that we have talked about on this and applying it to a dental private practice setting and just implementing it. And I think this will go a long ways towards making sure patients are safe, visitors are safe. So please take the time to read this. I think it's safe enough at this point for the vast majority of patients to have regular dental care. In fact, I think it's important. I think that should have been done all through the pandemic. I think the simple fact that the inflammation caused by in the mouth is it chronically can undermine your ability to resist infections, and we've known that with diabetes. We know that those inflammation in the mouth increases your risk of heart disease, and if you're a heart disease patient, it increases your risk of getting severely compromised with coronavirus. So anyways, knowing all that, we're still asking some of our elderly patients to postpone even treatment, right? Any kind of treatment, just because the risk is high until we see some of the numbers go down. And we're even asking some of our younger patients who might be medically compromised, hey, listen, so it's a very individual thing. It's important that you have that discussion with your dentist, and we're certainly going to be having it with our patients, okay? So listen, I hope you found this helpful. There's so much information here. I've tried to distill as much as you can. The point being that I think at this point, we need to make sure we return to our routines and we do it mindful of individual needs and not just do this in a blanket way. I think that's the best way to approach this. Please take care of yourself. Be safe out there. And if you have any questions, feel free to reach out to me. I'll be happy to discuss. And ultimately, remember, you have to make the right decision for you. Just keep in mind that it's not just you. We're all kind of handling this together. Okay. Have a good day. Thank you.